Hey everybody, it is Matt. Welcome back to OK Aussie. Sunday, the 17th of August. God, where did it go? 3:44 p.m. Yeah, miss. How are you? Here's a simple answer. Chest pain. Not doing all that good. Not surprised. She hasn't slept all night. And I actually do mean she has not actually slept a bit at all last night. So very, very fatigued. I just need to see where you're at. Why would that not go in the hole? Right, ma'am. Yeah. No surprise. No surprise at all. Alright. Just need to see where things are at. Let's actually get Bluetooth on. Oh, bumper. Is the chest pain sustaining?
No.
Is it flayed?
No.
Is it still there?
Yeah.
Okay. I am too tired to do this. My brain can't function.
Sorry.
Oxygen stats are 94, heart rate is 57. Let's just do a quick little blood pressure and then we might give you some nitrogen spray. Oxygen stats are 91, heart rate is 57. Time. Looking quite pre-syncope with a sudden drop in heart rate and oxygenation. Right, man.
Oh.
I'm just going to take your blood pressure and then we'll give you some nitrogen spray. Oxygen stats are 94, heart rate's 59. It's currently 347. Oxygen stats are 92, 91. And that's an oxygen alarm, 88. Dyan, can you hear me? Okay. Oxygen stats are 87 and sustaining. Oxygen stats are just coming up to 90. Okay, kid. Oxygen stats are dropping. 88. 87. Hello, darling. Blood pressure is 110 over 73. Heart rate is 60 at that point in time. Okay, oxygen stats are at 90% again, so you can see what's happening with the oxygen. This is in real time. It's currently 3:48 p.m. Sunday, 17th of August. Oxygen stats are still low. She is on an oxygen concentrator at level 2 throughput and she's only getting 90% oxygen at the moment. Heart rate's 57. Ticking. So it looks like the first parts of the seizure coming through right now. 3:49. So we've got a seizure posture. Figure 4 arm cross. Hey Google, start timer, 10 minutes.
Got it. 10 minutes. And that's starting now.
Oxygen stats of 93 on level 2 throughput, increasing throughput. Level 3. Oxygen stats 93, heart rate 56. Okay, temperature, fibrils 37.5, just on the very low end, but start point of fibril. Oxygen stats remain at 93, heart rate's 59. Lip smacking action, rapid. Starts at 97, heart rate is 67 but dropping, 64, 59. Still got a seizure happening currently. Locked to posture. So up. Doing really well. Current time's 3:51. Oxygen stats are 97, heart rate is 59. Oxygen concentrator just dropping down to level 2 throughput, 97% oxygen saturations. Currently 352. Seizure 352. Stay there. Really well. Secondary seizure 353. Supporting the left arm, right arm, sorry. So you're breathing down with me. So you're breathing down. Secure. It's secure. Slow your breathing. Very solid hyperventilation. Oxygen stats are 97, heart rate is 58. Come on. Conclusion 353. Let's get some medications ready. Countdown timer is 5 minutes since initiation of the seizures. Currently 354. My darling. So we've got some pre-syncope and syncope action in between seizure subsets. So multiple small short duration tonic-clonic seizures with syncope in between. So this is not a status epilepticus sustaining a singular seizure. She has got ability coming around out of the seizure in between. But we have our own threshold of duration for these. Sorry, Gabby's dollhouse. You can stay at the top there, darling. She's okay. She's okay. Shaking left arm posturally.
Oh, no.
Oxygen stats of 97. Heart rate is 55. It's reading. Syncope. I'm not going to be able to get some oral medication into her. I was hoping she'd be able to swallow some clonazepam as a muscle relaxant, but that ain't happening. Oxygen stats of 98. Heart rate is 56. Getting oromandibular dystonia. Oh no, get the nasal prongs in, sweetie. I know, it's a sensory nightmare, I get it. I'm so sorry, but you need the oxygen at the moment. Convulsing through the chest. Lip smacking right side. Okay, you'll have me a bit of difficulty with the breathing part of things and swallowing. Okay. That's to go. Yeah, let's just drain that out, eh?
Ow.
Chest pain. Strong indications. 356. Nitrolingual GTN spray applied. 356. Hey Google, start secondary timer. 5 minutes. Sorry, Mum.
For 5 minutes, and we're starting now.
Sorry, Papa. It's okay. I know, but don't feel good, but you need it. I'm so sorry. I'm so sorry. Got 2 timers. First timer I've commenced is a 10-minute countdown timer since the seizures have started. If the seizures aren't breaking, then we'll go with midazolam. Second timer is for GTN, nitrolingual spray, for indications of chest pain with angina. It's probably with tachycardia. No, we're low. We're actually dropping low. We'll probably get low alarms on heart rate, 52, 51. Oxygen stats are stable at 98, but we're on level 2 throughput oxygen. Oh, come on, baby girl. So the 5-minute countdown for the GTN will give me an indication whether the GTN is working for the chest pain. Until she comes around, I can't give her oral medications. Okay. You're okay. You're okay. Countdown 358. Seizure commencing again. Just supporting. So be careful with the high flapping right arm. After a anterior dislocation of that right glenohumeral joint, she's got a human sac injury, so that shoulder can pop out with the Stanley's hypermobility incredibly easily. So we'll just be careful with dislocations. Slow your breathing. Slow your breathing. Slow your breathing. With me. Syncope. We've got blepharism in the eye, plus oromandibular dystonia in the face. The segmented cranial dystonia is still in between these subsets. So it's a mixed bag of neurological simultaneously. The passing out syncope with not enough oxygen and blood flow to the brain at the moment. We've got the dystonia, which is a motor movement condition of contractions, and you've got tonic-clonic neurologically happening simultaneously. Go. Slow down. First timer is about to commence, which is the 10-minute timer on the seizures. Hey Google, stop. Dyan's got a genetic chromosomal disorder called 22q11.2 deletion syndrome. It is a microdeletion of the 22nd chromosome. Getting into a restive tuck status of recovery, 359. Now, normally, when we see this restive position, that normally hopefully starts to indicate conclusion to things such as the tonic-clonic seizures. Doesn't mean that the heart or respiration issues or the dystonia or anything else has stopped, and doesn't even mean totally about the tonic-clonic seizures have stopped, but we're looking. I'll tend to look for indications of strong yawn indications, sucking air in. You might get some head pain from the nitrolingual spray, so if you get some headache, let me know. Ticking action, which is also the Tourette's. It's a mixed bag neurological. Like I said, you've got dystonia, you've got Tourette's, you've got tonic-clonic seizures coming in. Let's see, go. Thanks, kitten. Now, Tourette's are commonly seen post-ictal after a conclusion of tonic-clonic seizures as well. I need to give her some muscle relaxant as soon as she's able to sit up and swallow. But we're not sure whether she's finished out of the seizure at the moment. So, no, exactly.
No.
So as I was saying, this genetic chromosomal disorder that she's got, she's missing between 30 to 50 genes. Several of those genes have been identified particularly with seizures, because 65% of patients with 22q will have seizure and seizure-like activity, 5.1% will have epilepsy. Here we go, 3 million DNA building blocks are missing, and it affects clinically about 185 clinical symptoms. Second time we're about to come up, we'll check with her heart in a moment. Oxygen stats are 97, heart rate is 70. Hey Google, stop. Okay, done. Chest pain. Chest pain?
No.
No, good girl, that's all I need to know. Did you bite your tongue?
No.
Is it the taste, is it?
Dave.
The taste. Okay. I need you to be out of sit because I need you to give you some medication.
No.
Yep.
No.
Yep.
No.
Yep. Oxygen stats are 95. Heart rate is accelerated at 86. Might not be giving anything orally right this very second. Oxygen stats are 95. Level 2 throughput. Heart rate is at 80. Indications of some pain behind the left knee. Just checking for any focalized dystonia. Syncope, totally passed out, 4:03 p.m. Syncope in conjunction with heart rate drop. That was a very sudden drop, going from that 85 down to 71. And conjunction with that was the syncope simultaneously. Oxygen stats are at 96. Hi, sweetie. Hello, darling. I've just been having some seizures. You've still got some dystonia going on at the moment. I know you're feeling a bit of nausea. I'm going to give you an anti-nausea medication right now. And your Tourette's is activated. Oh, sweetie. Take some deep, slow breaths with me, please. Oxygen starts at 97, heart rate has accelerated up to 90 beats per minute. Slow this down. Slow your respiration. I'm going to put something under your tongue. It's just going to dissolve and it's going to stop making you feel sick. Good girl. Ondansetron, 4 milligrams sublingual, 4:06 p.m. Just let it melt in your mouth, sweetie. Just let it melt. Generalized dystonia, which is the chorea. That's all right. Really, really well. Oxygen starts at 97. Now, why we're in this situation last night, no sleep at all. Dyan was unable to initiate sleep. We had a very disturbed attempt at trying to sleep. We couldn't get her to sleep. So there would be, if lucky, 5 or 10 minutes sort of snatches of sleep. So no real sleep quality, no deep sleep achieved. And as we know for Dyan, sleep issues are primary to getting seizures within that 24-hour window. This action, the generalized dystonia that she's showing at the moment, ain't helping anything. The anti-nausea that I've given should kick in pretty quickly, the ondansetron. Hello, beautiful. Hey, sweetie. Hi. How's your chest feeling? Chest pain? That is your hair tie. Leave it. Leave it. You don't need to touch it. It's okay. It's alright. It just keeps the hair out of your face if you're being sick. It's okay. It's not tight to your skull. It's in a loose fit bun at the back. Don't pick on my bum. Oxygen starts at 96, we're on a level 2 throughput, so she should be a little bit higher than that. 84, 85, 86 is the heart rate, it's accelerating. I bet it is, kitten. Now you'll notice that the tonic-clonic seizure sets have self-terminated under a 10-minute window. So before reaching my set mark, which was 10 minutes in this case, of non-contiguous tonic-clonic seizures, so I haven't applied midazolam. I do have some other meds that I want to give her, but at the moment, as you can see with the nausea, it's going to cause gagging and reflux. It's not going to be an easy thing to get in. So we'll start with an ondansetron just to try and reduce the nausea. Using the GTN, the nitrolingual spray during this can quite commonly open up the capillaries and cause a bit of a headache around the front temporal lobes. So she's not indicating anything at the moment, so that's good. Oh my God. It's currently 4:09 p.m. It is 19 degrees outside and inside it is 22.8 degrees here in Perth, Western Australia. Blood pressure is 102/60, heart rate 75. Sorry. Where is Maxie? That's a good question at the moment, darling. Yeah, he's out of the way for the moment. Willow's over on the tower. What's wrong, sweetie? Oxygen stats are just dropping down to 94, increasing throughput to level 3. She's already on an oxygen concentrator, so the oxygen should be higher. Heart rate is at 66, as it's just dropped down from 70. Sweetie, can you swallow some medication for me?
No.
Well, I need you to.
Yucky.
I need to give you some clonazepam, sweetie.
No. Yucky.
I need to give you some medication. Sorry.
Say no to drugs.
Yeah, say no to drugs, kids. Exactly. Oxygen stats are at 93%. She's on a level 3 throughput on the oxygen concentrator. Sweetie, if I give you some tablet, can you swallow for me, please? I need you to try. Do you hear me?
I don't want it.
I need you to. It's going to help you feel better.
No.
Darling.
No, please, no.
One tablet I need to give you, so we don't give you the yucky one. I'm trying to give you the nice one. Deal? I'm trying to give you the nice one, so I don't have to give you the yucky one. Can you just help me, please? I'll be quick. I'm going to help you, okay?
Different one. Different one.
I can't. I don't.
Different one.
Sweetie, I need to give you this one.
What is it?
This is a clonazepam.
Yucky.
It's not yucky. This is not yucky, darling. This is not yucky, okay? Right. I'm going to put it in your mouth, and then I'm going to help you drink, okay? We're going to do this in one go. I know you got a bit of nausea, but it'll be settling now. Sorry, Bunny. I'll give it to you. Here we go. Come on. Work with me. Work with me. On the count of 3. On the count of 3. 1, 2, 3. Let's go. I'm putting it in the mouth. Good girl. It's in the mouth. Good girl. Little sips. Swallow. I've got it here in case you want another sip. Okay. Sitting up. You need another sip? No, you can go. Oxygen stats are at 93%. Heart rate is at 98, 100 beats per minute. Orthostatic intolerance with the POTS, postural orthostatic tachycardia syndrome, will increase her heart rate because she's in a more upright sitting position. Of course, with syncope, we have to be careful that she doesn't fall over. Hip to the side, we don't want her banging her head or falling out of bed. Oxygen stats are at 92. Ready?
Where do I see it?
If you slow your breathing down, just try and do a little pan for me. Slow it down. That's okay. That's okay. That's okay. Oxygen stats are at 90% on a level 3 throughput. She should be able to get better oxygenation in at one time. The alarms may go off. It says flapping between 90 and 91% saturation of oxygen. Heart rate 74. It's currently 4:14 p.m. It is Sunday. So, don't fall over. Thank you very much, Lou. Hey, sweetie, can we sit back a little bit? I've got the bed coming up to you. Oxygen stats are just dropping down below the 90. Come back for me, girl. That's the go. That way we don't fall over if you're lying back. Doing really well. So you can see where the oxygen stats are at the moment. She's on an oxygen concentrator, level 3 throughput, but she ain't doing all that well with it. It's 4:14. %, oxygen saturation at the moment is what I'm getting. I need to try and get this up. So it's not just a little, oh yeah, she's flipped down and it's just there for a second. This is sustained oxygen saturation below the 90% threshold. Coming around. Good girl. Some deep breaths, kitten, for me. Come on.
No.
Yes, I'd like you to have some deep breaths, please. Darling. Darling. Hey, sweetie. My little ponytail at the back looks terrible. Haven't done the best of job on that one, have I? It's 4:15. So, what have we given her? On Danzatron for the nausea. Hopefully should be settling things down. GTN or nitrolingual spray for the angina that she experienced during that. Hit the 5-minute threshold, seems to resolve. No secondary spray in follow-up. That seems fine. Blood pressure was in okay range. Remember that she's normally very low blood pressure and bradycardic normally. We're getting some heart rate increases up and above the 100, but the oxygen saturation drops are what I'm seeing mostly down into 86-85% saturation during this phase. And that's whilst on an oxygen concentrator level 3 throughput. I've just given clonazepam. She's got an axial tilt at the moment, so you can see how the neck is tilting and doing these things. This is part of the axial tilt dystonia that she'll sometimes get. So not only will she get the segmented cranial dystonia, that's the part where you have the blepharism with the eyes or the oromandibular with the jaw, but the axial tilt is where the neck will actually tilt on the axis, depending on which way we're going in this phase. Hello, sweet pea. Along with some mixed bag things. So we've got some syncope, losing some cognition during this, and we've obviously had some Tourette's with the ticking action as well. Hey, beautiful, I'm just here. It's currently 4:17. Oxygen starts at 96, heart rate is 63. You can see the jaw thrusting on this left-hand side, which is the bruxism and oromandibular. So the bruxism is when you've got grinding of the teeth. The oromandibular is when the jaw and the mandible muscles are involved. That's part of the dystonia, segmented cranial dystonia. Dystonia originates for Dyan in the basal ganglia, the part of the brain where she has bilateral calcification, along with the movement condition, which is known as FARS. The dystonia she's shown today is axial tilt, segmented cranial, so you've got a neck rotation, which you wouldn't normally be doing. You've got also some left thrust going on, so we might also come through into some seizure in a moment. So let's bring her down out of here. Right hand posturing indication. Yeah, well, we might be actually applying the midazolam in the moment, the way things are going. Generalised dystonia. Oxygen starts at 95, heart rate is 64. I'm leaving the head of the bed up a little bit just to try and keep the heart rate. Nicole, sweetie, I'm sorry. Just got a lot of movement going on. Is your nausea settled down?
Yes.
Yep. What's your pain levels like?
Can't feel.
Can't feel. That's not a bad thing. Room temperature is 22.9. Feeling cold to touch on peripheral of right. Toes are fine.
Cold. Good night.
Hey, sweetie.
Good night.
Good night. You going to bed, are you? That's lovely. A lot of vigorous shaking going on. I don't know if you can see that on the camera or not. So you can see all of this action through the upper torso. Hands are at rest, there's no tension coming through the hands. No tension through the feet. We've had a lot of jaw thrusting to the left with the oromandibular in the face.
It's cold.
It's cold, you got the blankie here, bub. Oxygen stats are 97, just bringing the oxygen concentrator down one level to a level 2 throughput. Heart rate is at 63. First of the major yawns we've now experienced at 420. Remember, the yawn indicators are what we look for to show a conclusion of tonic-clonic seizures. However, Dyan is shivering.
I need
So 37.4, so she's come down 0.1 of a degree since the initial thing, so it's still warm. The room is warm enough, and yet she's showing indicators. I'll apply the heater in the room. So I've just applied the heater at this stage. What's else, sweetie? Your nasal cannula. You're okay? Oxygen stats are 97, heart rate is 65. I beg to differ on the okay until we see some other indicators. Now the clonazepam should actually help stop the dystonia side of things, hopefully within about a 10 to 15 minute period. We're still getting left side jaw thrusting going through.
It's cold.
Yeah, I know, Bubba.
What are we gonna watch?
What are we going to watch? At the moment I'm watching Eyes on You. So I see that you... Ratatouille, that would be pretty cool to watch. Chest pain has subsided, you're not feeling anything? Nothing. Headache, do you have any head pain? No? Good girl. Bit on the top of the head. Okay, that's fine. Just tip to toe. I just need to see your toes for the moment. Yep, I do. Can you just wriggle your toes for me, please? Okay, movement both sides. That's cool. Thank you very much, Lee. We'll keep them nice and warm. About 15% of the time coming out of tonic-clonic seizures like that, Dyan could have a paralysis or paresis. That's the second of the yawns. That paresis is known as Todd's paresis, and it can affect both the lower limbs, sometimes the upper limbs, but normally the lower limbs. Only seen in about 15% of the cases of her tonic-clonic seizure sets. What is that? You're being a little bit dramatic. She's a bit dramatic at times. I'm strangling you, or are you strangling yourself?
My leash.
Your leash. I'm actually going to take it off. Your oxygen stats at the moment are at 98%. How about if I take it off, because you're going to end up strangling yourself if you do that.
Eyes.
It's in your eyes. You can't feel your eyes? Okay. We'll just bring the bed down flat as she goes into her left roll. Fatigue, very commonly, immediately post-ictal, is what I expect after tonic-clonic seizures. It used to be the go all the time. Sometimes you'd even sleep for up to 3 hours. The physical exhaustion, the exertion of the shake and bake, going through that was very, very tiring. That's another one of the yawns I've just heard then. So that's the 3 sets of yawns. I don't see any more tonic-clonic seizures happening at this stage. So that part of things I really do feel is fine. So these are the indicators that we've learned specifically for Dyan. Remember, any of the things that we talk about are specific to Dyan. Head pain or your hair? Both. Can I get that out for you? Can I get that out for you? That's very dramatic. I'm not doing anything. You're so dramatic, it's ridiculous. Right, hair lacking is off. That's why having all these things close at hand, whether it's in the top drawer, on the emergency med cup, makes our life a heck of a lot easier. Thank you.
Mean.
I am not mean. Any headache? Having headaches immediately after seizures are very common. So in the post-ictal stage, they tend to be short duration, normally only around about 5 minutes max. I'm just going to give you some CBD, sweet pea.
Oh my goodness.
Oh my goodness. Just drawing 0.5 mils of the 10-10 combination CBD and THC. Little green farmer. There you go, ma'am. Oxygen stats off concentration at 95%, heart rate's at 74. I haven't had to use the midazolam during this. What's wrong? What are you looking for? So I'm just replacing the midazolam back into the location where that goes. Everything has a home. That means I can find anything, whether it's day or night in the middle of an emergency, very, very quickly for seizure management. And that's why we've set it up this way. What's wrong, kiddo?
My head hurts.
Your head's hurting. Well, hopefully the CBD that I've just given you is going to give you a bit of a break. Now, interestingly, because we had some high predictability of this happening today, I did offer Dyan some additional sodium valproate in a liquid format this morning.
Did it work?
So we gave her 5 mils, which is equivalent to the 200 milligrams of CBD sodium valproate, which is also known as Eplum. When we have high indications
Did it work?
that there's a risk factor, we try and increase the therapeutic levels. Now, believe it or not, what we've seen over the years, that's probably helped to take the edge off the seizures. It's taken the edge off the severity, the frequency and the intensity, and it's probably the thing that also stopped it from tipping over into a status. Status epilepticus is where for 5 minutes straight a seizure will go, or you're having continuous seizures without a break and not losing any consciousness in that window. You had some breaks, you had some intermittent cortisons, you also had some syncope where you're actually losing consciousness through lack of oxygen to the brain during those phases, but you weren't hitting status. That's why I increased the timer for us in this situation before I was going to give midazolam. And you luckily self-terminated your seizures without me needing to use the ASM anti-seizure medication. So that's a good thing, but your dystonia kept going, unfortunately. Your oxygen stats are 96% off concentrated. Heart rate is 65 beats per minute instead. No, it's not coming off. That would be nice, but not quite
Why
yet.
is my elbow sore?
You were doing a lot of ticking actions, and during your seizure action, you were also doing hyper tick flings, which of course can hurt, and it might also be soft tissue. You might have sublux. So I'm just going to check the stability of your joint. Okay, you've got a bit of sensitivity just on the lateral side.
Pull it again.
Yeah, we'll try again. But it's just a little bit sublux. So, good girl. How's that feel? Good. Okay, we've got a win there. I just need to have a quick look inside your mouth, if I may, please.
No.
Cool. Can we look up your nose instead? Get your tongue out of the way. That's so big.
Why?
Can you have a
I
quick look?
need a butt.
You were doing a lot. Okay, so left ulceration on the mid-range. Open up, please. Tongue back in, Papa. That tongue of yours is going to get yourself into trouble. Relax. If I ask for you to do something,
What?
open your mouth and don't move anything
Where
else.
do I pull my tongue?
Leave it in your mouth. How about that?
There's many locations.
Just where it is at rest. Okay, good. Thank you. Okay.
It's a lot.
Okay, it is a lot. It's a bit of sensory overload. Okay, bit of redness at the bottom of the palate as well. Bit of an ulceration on the lip. Dyan doesn't always bite her lips, cheek or tongue during seizures. It can only probably happen, I'd say around about 25 to 30% of seizures. It's not a consistent indicator and/or sign. Just as much as wetting yourself is not a consistent sign that if you wet yourself, you had a seizure. That probably only happens in about 35-40% of seizures.
In nocturnal.
In nocturnal, you do? Yeah, absolutely. And in the early phases of seizures, you used to do that all the time.
Yeah.
As your seizures evolve, and particularly under ASM, anti-seizure medication, you have a bit more time.
I don't throw up anymore.
Thank goodness for that, because that's a horrible sensation. Oxygen stats are stable, still at 96%. Heart rate is at 68, 69. It is 4:31 p.m. Good night. Are you going to sleep, are you?
I want to watch something.
You want to watch
I
something?
want to sleep at the same time.
She wants to sleep at the same time. Okay, so we're going to keep an eye on her for just a little bit as I wrap up here. So, first of all, not medical professionals, so we're not here to give you individualised medical information guidance. Okay, that's what your primary care physician or a specialist is for, so please go and see them for any medical information. What we're doing is sharing Dyan's experience, lived experience with multiple rare genetic conditions, particularly the umbrella condition for her, which is 22q11.2 deletion syndrome, as I said. Of those, about 65% of patients do have seizures or seizure-like conditions. 5.1% of those will have epilepsy. There's a lot of consistencies as well. 20 to 30% of them will have autism. Dyan's autistic. 40 to 60% will have ADHD. Dyan's ADHD. A cohort will have Tourette's. Dyan has Tourette's. So as you go on, out of that 180, 185 possible clinical symptoms, Dyan's got a fair few of those racked up. So a lot of things for her to deal with. Today's episode, we haven't had to apply the emergency medication, so we didn't give them midazolam, so that's a good thing. I'm happy for that. She is tired. She's rolled over, as you can see, in this position, and she's just wanting to rest and relax, and that's perfectly fine. I'm not surprised. Sleep initiation is very difficult for an autistic at the best of times, and sometimes physically when things are changing, sometimes changes in medications, change in food, and post-ictal an urge to need to go to the toilet will quite help. Now I've got to do this one-on-one carer assist together there, because if she was to try to walk with ataxia, post-ictal, post-seizure, she's likely to shuffle. Her gait will probably not be able to walk properly. She'll walk with a wider stance. I'll be dragging her and carrying her, and she'll probably likely be a falls risk. So rather than letting her do that, we're going to wrap up the video here. We're going to say goodbye to you. Thank you very much for being here to support and watch. Big thumbs up of support and encouragement. Comments, questions, ideas and suggestions, leave them below. If you're new to the channel, don't forget to subscribe, hit the notification bell so you can see more of our content, and please share our channel to help increase the awareness of dealing with seizure management for patients who've got rare and genetic chromosomal conditions like Dyan. Thanks very much for watching. Bye for now.